Welcome back to the DAMY vlog. My name is Dr. David Duizer. I'm a naturopathic doctor and the medical director at DAMYhealth.com. Thank you so much for tuning in. On this show, we cover all things holistic health and wellness related. If you're interested in holistic health and well-being, this is the channel for you. Please subscribe for more videos like this one. Today on the show, we're talking about a question I was asked recently. Recently, I was in clinic and I got asked by a patient of mine, what's my favorite part of my clinical practice? What's my favorite part of my career in general? And I have to say that the way I responded and what I truly believe is that my favorite part of my clinical practice and my career in general is supporting people who have already been diagnosed with chronic disease, supporting people along their journey to optimal wellness and to healing. The reason I mention this, most of my day is spent helping people reduce their medication load and reduce their side effects to their medications. This is a major part of any naturopathic practice, but the clinic that I have joined and that I'm a part of and that I love working at is close to a hospital. It's close to a series of specialists. It's on a busy street that's considered a medical street. And because of all those factors, and we're associated with a pharmacy, and because of all those factors, I have jumped right into the integrative approach to chronic disease management from day one of my clinical practice, and I have loved every minute of it. Now, what I'm doing mostly are reducing medication dosages when people get healthier, so helping people get healthy and then subsequently having to reduce their medication load, and then as a secondary part of my practice, reducing the side effects of medications. So I'll go through a few examples of where I spend most of my time. On the reducing the medication load, we're finding that as people become healthier and healthier using a holistic approach to chronic disease management, we have become able to reduce thyroid medications, we've been able to reduce insulin requirements, we have been able to reduce depression medications like SSRIs, and we have, of course, pulled lots and lots of people off of statin medications. So those are kind of my top four, but many other medications we've been able to reduce, including pain medications like gabapentin, and of course the over-the-counter NSAIDs like ibuprofen, using natural therapies and a holistic approach, an integrative holistic approach to chronic disease management. We have been able to switch people from synthetic hormones to bioidentical hormones. We have been able to pull people off of DHEA and testosterone. We've done all of these things, anxiety medications on a day-to-day basis and insomnia medications on a day-to-day basis. This is what I'm spending much of my time doing. And the reason it has been such a successful career for me thus far is because of the holistic approach. It's because of the naturopathic principles of our medicine and how they facilitate overall health and well-being so that the systems of the body function better and the need for these medications are reduced. We talk a lot on this channel about the holistic approach to weight loss, but the holistic approach tying up all the different lifestyle factors and all the different organ factors or organ functions and improving all of them really reduce the need for medications in most disease. So that's what I'm experiencing on a day-to-day basis, and that's what I teach people and show people how to use in their personal lives. On a secondary aspect, on a separate note, a lot of my day is spent reducing side effects of medication. Because of my interests and the way my practice has developed, I do a lot of integrative cancer care, and I do a lot of IV vitamin C in chemotherapy and radiation. So in our province and in my core beliefs in general, I support the specialists in our community, and I really focus a lot of my time helping reduce the side effects of chemotherapy. We try to get people through their chemo as quick as possible and as efficiently as possible so that they do not need to delay, so they can get through it, so they can either have the surgery or the radiation they need, or they can just be done with their conventional therapies. The way we do this, we use IV vitamin C, we use things like melatonin, we use lots of therapies like astragalus and reishi mushroom and all these different naturopathic therapies to help people get through chemotherapy as quick as possible. If you're not familiar with chemotherapy in general, very often people experience anemia, they experience low white blood cells in general, and these factors can cause them to have to postpone further treatments. And that just makes their whole experience with the cancer agency much, much longer. So we find that naturopathic therapies help them through their conventional therapies so that they don't have significant side effects. We spend a lot of time during IV vitamin C's talking about nausea and vomiting, talking about post-chemo low energy, talking about post-chemo brain fog. We spend a lot of our time talking about this and about these side effects and actively trying to reduce them. And we have tons and tons of success with these therapies. So that's my day-to-day life here, helping people feel better, helping people reduce their need for medications, helping people improve their laboratory scores, improve their inflammatory scores, improve their red blood cell scores, their white blood cell scores, and then reducing the side effects of super, super toxic medications. We have a lot of people coming in on prednisone, specifically high doses, and we have a lot of people who are, of course, in chemotherapy and radiation, experiencing the negative side effects of those. So that's how I'm spending much of my day. If you're interested in holistic health and well-being, please subscribe for more videos like this one. Thank you so much for watching. Hope you have a great day.